We're here today at the 28th Annual Alzheimer's Regional Conference here in Seattle, Washington. And today I'm joined with Dr. Nancy Isenberg. Nancy, thank you so much for joining us today. Tell me a little bit about yourself. What brings you to the conference here?
Well, first, thank you for having me. It's my pleasure.
Thank you.
And I'm a cognitive neurologist, and I co-direct a memory wellness center at Virginia Mason Medical Center, where we provide comprehensive evaluation and treatment for patients and families with cognitive symptoms, behavioral issues, memory issues, such as an Alzheimer's disease or other forms of dementia.
Wow, so essentially people that have an impairment or are beginning to develop symptoms of some type of memory impairment, they would come over to Virginia Mason?
Yes, and often patients and families are very frightened. And so we work with them to help to provide a comprehensive assessment and then to give them evidence-based tools and treatments to help either reduce the risk of developing dementia or to slow the progression of their dementia.
What tools are there out there that can help in that arena?
So as we know, neurodegeneration occurs for decades before people manifest clinical symptoms of their dementia. And vascular disease, metabolic factors, and other factors which are modifiable can reduce the risk of dementia as we age. So for example, 30 minutes daily of cardiovascular exercise can significantly reduce dementia risk, number one. Number two, Mediterranean diet, healthy diet, plant-based diet, low animal fat, high in olive oil or nuts can reduce your risk. There was a terrific study out of Spain. 3, getting adequate sleep. 4, treating hypertension, hyperlipidemia, diabetes, or metabolic syndrome. Also, sleep apnea is underdiagnosed and So one of the most exciting things is that we can train our brains, and we make new brain cells along the lifespan. And we know there are ways to stimulate growth and promote connections among brain systems. Aerobic exercise actually stimulates growth of new brain cells. It also strengthens connections among brain cells and helps to promote blood vessel growth in the brain, which all contributes to improved memory, cognition, and overall functioning. We also know that mindfulness-based stress reduction or meditation practice can help. There was a terrific study by Sarah Lazar from Harvard demonstrating increased cortical thickness in meditation compared to individuals who did not meditate.
So now when you say cortical, is that just from an internal portion of the brain, or are you talking about the gray matter versus?
So the cortex is the gray matter, and we know that growth of new neurons occurs in 2 areas of the brain, the hippocampus and the entorhinal cortex. And these areas are vital for learning and memory, things which are challenged as we age and which decline with dementia, such as an Alzheimer's disease.
I have a source out here that tells me I should be asking you about a program called Worry Well. So
many people in midlife will come to me with memory concerns, and their fear is that they're developing Alzheimer's disease. And simply if you misplace your keys, or you can't find your wallet, or you forget to pay a bill, that does not necessarily mean that you're developing a progressive neurodegenerative disease such as Alzheimer's disease. And so when individuals come and see me, we have an opportunity to do a comprehensive evaluation to determine whether they have dementia or whether they simply are worried well.